We know the signs of a heart attack, the pain in the chest and arm. But what is a foot attack? It's when arteries in the lower limbs get clogged with plaque, preventing blood flow and oxygen from reaching the lower leg and foot. And it's painful. It's dangerous, and it is caused by the most prevalent disease you've never heard of, Peripheral Artery Disease, or PAD. Now, Dr. Sahil Parikh of Columbia University Irving Medical Center and Dr. Jennifer Jones McMeans, Divisional Vice President of Global Clinical Affairs at Abbott's Vascular Business, join us to explain what PAD is and discuss Abbott's first of its kind dissolvable stent called Esprit. I'm going to get this right eventually. Esprit BTK system, which is designed to help with the most severe forms of PAD. Doctors, I hope I said that right. We'll find out in a minute. First of all, Dr. Parikh, tell us a little bit more about peripheral artery disease and how prevalent it is.
Thanks. PAD is very common. Peripheral artery disease affects about 40 million Americans, or 1 in 10. And it's really when you develop plaque that blocks the circulation to the legs. You've heard about it in the heart, called coronary artery disease, and it can cause a heart attack. Well, in the legs, it can cause a leg or a foot attack. And it deprives blood flow to the legs, and really starts by giving symptoms of pain when people are walking or doing exercise, and then gradually can progress and cause pain at rest. And in some cases, it can get so severe that it can deprive blood flow to the legs and induce the production of wounds, which can ultimately lead to amputation. So it's a very serious problem.
Now, what are the symptoms and how dangerous is this?
So again, the symptoms really can start by relatively mild things. Patients will often complain about their legs cramping or getting tired when they're walking. Gradually, that can get worse. They can get pain at rest in their legs. Sometimes patients will say, I have to dangle my feet off the side of the bed because they feel numb or they're hurting when I go to bed. And then eventually, people can develop sores or wounds, and that's really the most severe form, which we call critical limb ischemia. And they're at risk for developing wounds that need amputation.
Now, Dr. Jones McMeans, tell us about Abbott's new dissolvable stent with this matters for people living with this disease.
Yes, at Abbott, we're very proud to introduce the Esprit BTK system, the first dissolvable stent to treat the severe form of peripheral artery disease in the arteries below the knee. Currently, there is a treatment option that Dr. Parikh and others do to treat, which is considered minimally invasive, to treat these arteries that become blocked with plaque and to open them up. And this is with a balloon, which is considered the standard of care, and it pushes the plaque back, and so to open the artery up. But the problem with that is it doesn't really sustain, and the artery ends up kind of bouncing back and closing up again and not allowing for that blood flow. And so what Esprit BTK can do is that once it's delivered and that plaque is pushed back, it is a dissolving stent. So first, it releases a drug, and that drug is going to be very helpful for keeping that blood vessel open and not closing up. But also, because it is a stent, it actually supports the artery to keep that artery open for a period of time, and that's approximately about 3 years. But this is very important because now the blood vessel is open, but it also creates treatment options, because with this severe form of peripheral artery disease, we do know that patients may have to come back to be retreated. So we're really excited that this is the first option that has been made available in probably about 30 or 40 years, since balloon angioplasty has been always the standard of care.
Speaking of which, Dr. Jones, what makes this treatment option different than what has been used in the past?
Well, currently, like I said, currently what's been used in the past is just a balloon, and the balloon is just really not that effective. It's used to push the plaque back and open the artery up, but again, that artery gets injured, and if you think of it, it's kind of like a rubber band in that it's gonna recoil or close up again, and that's not going to be helpful, because some of the symptoms that Dr. Parik's been speaking of and the issues with wound and its most severe form of amputation are because there's no blood flow getting to that, the tissues and the foot, as you noted before, the foot attack. And so what Esprit allows us to do is open that artery up, keep that artery open, and prevent those, and hopefully lead to a situation where you're seeing less and less foot attacks, or even less chances that the patient's going to have to come back and be retreated.
Now, Dr. Parik, what should people do if they think they might have this disease?
I think, as always, the first thing is to talk to your doctor. I think patients need to convey that they're having these symptoms and not blow them off and say that, well, I'm just getting older and I'm getting tired, things of that nature, which I hear every day in my office. And then once their doctor sees them, they should be evaluated by having their pulses examined in their feet. And usually there are additional tests that are very simple and non-invasive, like an ultrasound, that can help diagnose the problem. Once a diagnosis is made, then treatment can begin, and that usually starts with simple things like medications to reduce cholesterol and blood pressure. People have to start walking more to improve their circulation. And if need be, the vessels can be opened with one of these techniques.
Now, where can our viewers go to learn more?
Yes, so if viewers are interested, they can go to abbott.com or also pad.info.com.
I've been speaking with Dr. Parik and Dr. Jones McMeans. You know what I think is interesting, doctors, is they always talk about innovation and startups with the college students and venture capital and all this other stuff. But in medicine, you guys have been startups and innovations for years. You think so?
Yes, I mean, Abbott, we're very proud of the number of innovations that we continue to bring globally to people, especially in the areas of cardiovascular disease, or similar to what we're talking about today with peripheral artery disease.
Man, it is amazing. Dr. Jones McMeans, Dr. Parik, thank you so much for joining us on Morning Blend.
Thank you.